My name is Enteral Turner. In this video, I'll be demonstrating NG tube insertion, enteral feeding, and NG tube removal. NG tubes can be used for medication administration, bowel obstruction, ileus, nutrition, or if a patient is NPO. At the start of this procedure, I will verify my physician's orders and identify my patient. I'm going to perform hand hygiene and don clean gloves. All right, so I will verify my patient by checking the armband and asking them to state their name and date of birth. I will position my patient into high Fowler's position. Drape my patient with a towel. And have with me a cup of water, ice, an emesis basin, and tissues. Then I will assess the patency of the nostril by occluding one and asking them to breathe through the other one. After checking patency, I'm going to measure the tubing from the tip of the nostril to the tip of the earlobe, down to the tip of the xiphoid process, and mark with tape. After marking, I'm going to lubricate 3 to 4 inches of the tube with a water-soluble lubricant. Now I'm going to insert the tube in a backward downward position, asking my client to tilt the head to chin to the chest and asking them to swallow water to help facilitate the insertion of the tube if they're able to swallow. If my patient starts to cough or become cyanotic or have an inability to talk, I will discontinue the procedure and notify the physician. My patient hasn't had any signs of distress, so I'm going to continue with the procedure and advance the tube. I'm going to temporarily secure it with tape. Now I'm going to verify placement by aspirating gastric contents and checking the pH. You can also check placement by chest x-ray. And once placement has been verified, I'm going to hook up to the suction or to whatever orders the doctor have, like feeding or whatever orders. Now I'm going to remove my gloves, perform hand hygiene, document the procedure, document the nostril, the nair used, the size of the tube, document the placement, document the verification of the placement and the patient's response. Now I'm going to go right into enteral feeding. Of course, I'm going to verify my physician's order, perform hand hygiene, don clean gloves, assess for allergies, identify my patient. All right, for enteral feeding, first thing, I already said I'm gonna verify my physician's order, check my patient, identify my patient. I'm going to prepare my enteral feeding. and pour it into the bag. I'm then going to I'm going to hang it up. If I'm going to instill it by bolus, it'll be a gravity bolus. We'll allow it to go by gravity, or we can hook it up to a feeding pump. But first, we have to check placement. And by check placement, we're going to aspirate gastric contents. If I remove 250 mils or less, I'm going to replace the gastric contents. If I get more than 250, if I get 500, or if I get 250 twice, I'm going to hold the feeding. My residual has been checked with the pH and it's less than 250, so I know I have verified my placement and now I can proceed with my feeding. I then will connect the feeding to the NG tube and set the feeding to the prescribed order. With enteral feeding, you need to flush with 30 mils of water before you instill the feeding and after you do the feeding after medication administration. You need to flush the tube every 4 to 6 hours, and check the residual every 4 to 6 hours, and also flush with water, 30 mils of water before and after each medication. You need to change the bag set every 24 hours, the tubing in the bag set every 24 hours. You need to cleanse the abdominal site daily if it's abdominal site feeding. After that, I will document the procedure, document the amount of the gastric residuals, document the patient's tolerance to the procedure, and remove my gloves for hand hygiene. Now going into the discontinuing of the NG tube, I'm going to verify my physician's orders, perform hand hygiene, don clean gloves. In real life, I would pick that glove up right there and discard it in the trash. But for video purposes, we're going to go on with the procedure. Now, to discontinue the NG tube, I already verified my physician's orders. I verified my patient. Perform hand hygiene, I'm donning clean gloves. I'm going to, of course, have my patient up in high phallus position and remove my tape. All right, while asking my client to hold their breath, I'm going to slowly remove the tube. I'm going to discard this into the proper container. But of course, before I removed this tube, I would definitely turn off the feeding or discontinue from suction that it was connected to. And then discard this into the proper disposable container. I will remove my gloves, perform hand hygiene, document the procedure, document the patient's response, document the nair and nostril used, and then I would also perform oral care and nair care on my patient prior to removing my gloves. Or I can come right back and do it, but definitely will perform oral care and nair care on my patient. and then dispose of my gloves, perform hand hygiene, and document the procedure. Thank you.